That's great. Good afternoon, everyone. My name is Miguel Blancarte Jr., and I will be moderating this conversation today, this multifaceted and shared disparities conversation for the Black-Brown dialogue. First of all, I want to start off by thanking Ambassador Torres Mendivil for the invitation, for having this important dialogue, along with the Cesar Chavez Institute and the Consulado de Mexico in Chicago. Also, I really want to thank our panelists that are here today. I'll share a little bit more about them. But this is a really important topic and conversation to have for very many reasons. I think after particularly what COVID has shown, or what it has really exposed, and the importance of Black and Brown unity. So to start off, I will introduce the Senator, Senator Celina Villanueva. Senator Celina Villanueva is born and raised here in Chicago's Little Village neighborhood, Little Village. She began organizing and advocating for Little Village, for Latinos, for the undocumented population as a teenager, and she's committed to building immigrant power, developing youth leaders, expanding voting rights, and engaging immigrant communities and allies. Celina has been a champion and a progressive champion in our communities, but really not only in our community, in the state and nationwide. Thank you very much, Celina, for being with us here today. Celina's left, we have Jorge Mujica, who's organizer of strategic campaigns at Arise Chicago. Jorge was born in Mexico, and he's participated in various movements until migrating into the US back in the late 80s, in 1987. He's worked as a journalist for Univision as well as with Telemundo, and he has received many prestigious awards for his reporting, his investigative reporting. Jorge's interest of the Mexican community is not really with that here in the States, but also abroad. And issues that he's worked on have been everything from remittances to voting itself. He currently leads groups of low-wage immigrant workers and really advocating for their rights. Thank you very much, Jorge, for being here and for all that you continue to do. On my right here, I have the pleasure of having the Chief of Staff and Director of the Cook County Health Board, Otis L. Story. Director Story was born in Anniston, Alabama, and he studied at Cornell University and at the University of Chicago, as well as the University of Alabama at Birmingham. He was the first African-American administrator of the Ochsner Foundation Hospital in New Orleans, and he's been in the healthcare industry, the hospital industry, for quite some time now, and he graces us with all of his wisdom and experience here in Cook County, the city of Chicago, and he brings all of that knowledge. He's been with us for a couple of months now, but really making his way into Chicago. Thank you very much for agreeing to participate in this conversation. As I mentioned, this conversation, multifaceted and shared disparities, is based on issues and themes that we consistently see that the Black and Latino communities face. These are systemic policies, it's systemic racism that oftentimes pivots both communities against one another, and that should not be the case. Because we do know that working together, we're stronger. We're stronger in order to really combat these issues that prevail, that consistently pit us against one another. With that, we have seen that COVID-19 has really exposed a lot of this, because I think working in Black and Brown communities, being an advocate for those that are disproportionately impacted, a lot of people already knew this, right? A lot of people already knew of these inequities and these disparities, However, with the magnifying lens of this pandemic, it really became evident that, yes, both communities are suffering and they're continuing to suffer. And so this is a really pivotal point because it allows us to really address these different issues, everything from healthcare to education to really economic policies as well that negatively impact both Black and brown communities. And so how is it that we can work together to really bridge the divide and really do so in a sustainable manner that isn't only about Band-Aids, but it's something that is sustainable long-term. So in the line of policies itself, I want to start off by posing this question of how are the current policies excluding our communities from access to fundamental rights? Senator Villanueva, if you want to start us off with that one.
So, muy buenas tardes and good afternoon, everyone. That's a big question, Miguel. Working on the state level, one of the things, and again, coming at it from the side of a community organizer into state level government, my push, because again, knowing Jorge from before, I was a legislator, was always to make sure that our communities were represented and that our communities were in the room as decisions were being made and were part of the work. As I've kind of been navigating this space, you see the discrepancies, especially from people who don't have interactions with our communities or refuse to see the interactions from our communities. So I'll give an example of this. We're constantly fighting to make Illinois the most welcoming state in the nation. And part of that is because we know that we have a huge population that is an immigrant population, not just Mexican, but immigrants from across the world, largely Mexican. But we continuously fight for policies like being able to have undocumented seniors access to Medicaid, which is obviously healthcare in the state of Illinois, and the fight for that and the way in which we were able to do that. But then getting pushback from people from a downstate Illinois who claim, well, there's no immigrants in our communities. And it's like, but that's not true, because based off of the population and what we know, there are particularly Latinos and in many, many cases, Mexicanos, that are in every single county in the state of Illinois, every single county. Because even though Southern Illinois is agricultural, who are farm workers? And so a lot of the times it's people kind of, seeing what they want to see, and so basing their decision making off of, well, I don't really have Latinos in my district, but part of the work is also trying to do like an internal push to get people to understand the importance of this. And I remember this because I did a fellowship a couple years ago when I first became a legislator, and I actually made friends with a couple of Republican representatives, and I got one of them to actually host a citizenship workshop. And one of the sessions of this fellowship was actually talking about citizenship and obviously immigration in our country, and particularly in Illinois. And of course, me being me and having worked at the Illinois Coalition for Immigrant and Refugee Rights, I have a deep understanding of the topic. So I was adding to the conversation, even though I was supposed to be listening to the presentation. And so a couple of the Republican representatives were like, wait, how do you know so much? And I got to talking to them, and I was like, look, you have people. They might not always look like me, but they're from all different parts of the world that live in your district that are able to become citizens at this moment, right now, but they just don't have the resources or the organization or something there to help them on that pathway. She came back after hosting the citizenship workshop, and she's like, Celina, I know that this might not be a lot for you, but this was amazing. I helped 6 people become citizens. And again, this is a Republican representative. Es una güerita, but she was so happy. And I was like, no. But you don't realize that's not just 6 people that you're helping to become citizens. That's 6 families and their communities and the impact that they then have. But part of it is, as an organizer, I know that. You do the relational, you build the relationships, and you help people move them into kind of understanding the issues at hand. But there are some people that just want to blind themselves to the reality of what's happening in our country, and that is we have a huge community in this country that we are part of the fabric of this country. And so when you talk about particularly like Latino issues, Latino Latinx issues, but then also Black issues, the reality is we're here. We are part of this country. We are part of the building of this country. We help build this country. When you think about the White House was literally built by enslaved Africans, like enslaved people who were brought to this country against their will. The reality is our country was built on our blood and bones and our sweat and our tears, and we can't continue to let people deny those things.
Thank you very much, Celina. Jorge, along those lines of current policies that are really excluding communities from access to fundamental rights, you work a lot with unions. And so in your perspective, what are some of these policies that really need to be remedied and modified?
Yeah, thank you very much. Good afternoon, everyone, also. Embajadora, gracias. Immigration status is a big divider, no doubt. You know, it's not the same thing when you're a citizen, when you're a legal permanent resident, or whether you have DACA or TPS or some protected status, and when you're undocumented. That's a big divider. But there's a big equalizer, and that's work. Because whether you are a 5th-generation white American citizen or a 2nd-generation immigrant from Europe, or you are an undocumented worker, if you work at, let's say, McDonald's, you earn minimum wage. That's it. It doesn't matter your background and status at work, basically. And we don't decide our salaries because we are citizens or we are not citizens. It's actually illegal to pay more to a citizen than a non-citizen. So that's the big equalizer. But within that equalizer, we have enormous differences. For instance, only in the state of Illinois and 7 more states in the United States, domestic workers are considered workers. According to federal laws, domestic workers are family companions. And that's racism applied to the extreme in the minimum wage law. It is because in order to get the votes from the Southern congressmen when the minimum wage law was voted, in order to get their votes for the labor law, they excluded their servants. And their servants were African Americans, no doubt. So it was a racist application of a law that until today, it still exists. Fortunately, the state of Illinois recognizes domestic workers as workers, yeah, thanks to the work our legislators have done. But so even if work equalizes many people, there are incredible differences structural differences to differentiate brown and Black population with white populations, et cetera, et cetera.
And so let me ask you this then, because you mentioned that work is that equalizer. You gave the example of, working and having a standardized pay. What are some benefits that you think would be beneficial to really make sure that we advocate for, that unite, and that will really benefit the Black and brown communities? Because if, you want to talk about standardized pay, but then should there be other resources on top of that, other benefits that can be provided to them that would really help provide more for these communities that we're really advocating for?
I could give you a list of like 200, but
Let's start off with a couple of them. Let's start off with a couple.
Yes, everybody knows that the big debate in Washington with the pending bill, which included passed, because it doesn't include it anymore, maternity and paternity leave. We should have that in the workplace, and particularly, again, because brown and black populations are the ones with higher fertility rates. So, if we don't have it, well, that affects brown and black Americans or people living in the United States in a higher way than it affects white populations. So examples like that. Of course, there should be the chance to organize in the workplace, to have your own labor union. The labor laws in the United States, for instance, don't have vacation. The word vacation doesn't exist in any labor laws. There are no holidays. They don't exist in labor laws. Celina, I want to invite you to propose that we have more than one break, because nowadays everybody's working overtime, and the law only says that you have one break in the 5th hour of work. And of course, that refers to people working in warehouses and companies and production companies. It doesn't apply to people working in offices. It doesn't apply to people working at home from the computer. Basically, that applies to the basic industry, which again has a majority of black and brown populations. So the list would be pretty much endless, but I could invite me some other day and I'll give a conference on that too.
No, well, thank you so much for that, for sharing that, because yes, maternal, paternal, paternity leave, that is extremely important. So if we do have elected officials in Congress watching, we are definitely advocating for that to be added into the bill.
Could I actually add?
Yes, please do.
And I want to add this because I am Latina, but equal pay. Because it still takes black women, and again, I don't know the exact dates, but it literally takes black women until August to make what a man makes, and particularly a white man makes. And it takes Latinas until basically the end of October in order to make up what a white man makes in a year. And again, that's for women because I'm a woman. But again, it's not that much better for Latino males or black males in this country either, so.
No, I agree, and we definitely have to advocate for, equality and making sure that there's that equal pay. It's equal work, equal pay. I think another one of those things would be potentially access to childcare, right? Because we have seen what this pandemic has done with our essential workers. Who are our essential workers? Those that are out and about that need to expose themselves, that were exposing themselves to this virus, and that also didn't have the income or didn't have the luxury to pay more for childcare when schools were closed down. And we saw how their lives were impacted, their finances, but also really their health, because in the fact that they needed to expose themselves. Director Story, I want to ask you, as far as policies that are excluding our communities from these fundamental rights, access to care, healthcare being one of them. From your perspective, how is it that we would be able to remedy some of these policies?
Thank you, Miguel, for the question. I'm going to pull this down a little bit. Socially distanced, I just feel better. I spent my entire professional career focused on 3 aspects when it comes to health care in this country, and that's access to acceptable, affordable care. I do not, cannot sense how anyone can function in any aspect of their life without having access to acceptable care. How can you work if you don't feel well? How can you work, if you don't have the ability to provide health care for your family? One of the biggest challenges that I see in this country is that we have a tendency to forget the history. Forget the history that has plagued us for generations. We talk about access to care. We have fought for generations to improve access to care in this country, and policies have been in place for years, going back preceding Title 18 and 19, Medicare, Medicaid, and then once again in the early 1992 and 1994 with President then